Top 25 GNM Staff Nurse Interview Questions and Answers. General Nursing and Midwifery (GNM Staff Nurse Interviews) are designed to assess a candidate's clinical knowledge, patient care skills, communication abilities, and professional ethics. Hospitals and healthcare organizations look for nurses who can provide safe, compassionate, and evidence-based care while working effectively within a healthcare team. Preparing for common interview questions can significantly improve your confidence and performance. This guide covers the top 25 GNM Staff Nurse Interview questions and answers that frequently appear in hospital interviews, helping you demonstrate your nursing expertise and secure your desired position successfully. 1. What inspired you to become a nurse? Nursing appealed to me because it combines medical knowledge with compassionate patient care. I have always wanted to help people during difficult times and contribute positively to their recovery. The profession allows me to make a meaningful difference in patients' lives while continuously learning and developing my healthcare skills. I believe nursing is not just a career, but a commitment to serving humanity with empathy, professionalism, and dedication. 2. Tell us about your nursing education and training. I completed my general nursing and midwifery (GNM) program where I gained theoretical knowledge and practical clinical experience. My training included medical surgical nursing, pediatric nursing, community health nursing, mental health nursing, and midwifery. During clinical rotations, I learned patient assessment, medication administration, wound care, infection control, and emergency response. This comprehensive education prepared me to provide safe, effective, and patient-centered nursing care. 3. What are the primary responsibilities of a staff nurse? A staff nurse is responsible for providing direct patient care, administering medications, monitoring patient conditions, maintaining accurate records, educating patients and families, and collaborating with healthcare professionals. The role also includes infection prevention, patient safety, emergency response, and emotional support. Staff nurses ensure that patients receive quality care while following hospital policies, ethical standards, and evidence-based nursing practices to promote positive health outcomes. 4. How do you handle emergency situations? In emergency situations, I remain calm, assess the patient's condition quickly, and follow established emergency protocols. I prioritize life-saving interventions, notify the medical team immediately, and assist with emergency procedures as required. Effective communication and teamwork are essential during emergencies. I continuously monitor the patient's vital signs and document all actions accurately. Remaining composed helps ensure timely, safe, and effective patient care during critical situations. 5. What steps do you follow before administering medication? Before administering medication, I follow the rites of medication administration, including the right patient, medication, dose, route, time, and documentation. I verify the physician's order, check allergies, review patient history, and confirm medication expiration dates. I explain the medication to the patient and monitor for adverse reactions afterward. Accurate documentation ensures patient safety and compliance with nursing standards and hospital policies. 6. How do you ensure patient safety? Patient safety is achieved through careful assessment, accurate medication administration, infection control measures, and effective communication. I verify patient identification before procedures, monitor changes in condition, prevent falls, and maintain a clean environment. Reporting safety concerns promptly and following hospital protocols help minimize risks. Continuous observation and patient education also contribute significantly to preventing complications and ensuring high-quality healthcare delivery. 7. Explain the importance of infection control. Infection control prevents the spread of diseases and protects patients, healthcare workers, and visitors. It includes proper hand hygiene, use of personal protective equipment, sterilization of equipment, and safe waste disposal. Following infection control protocols reduces healthcare-associated infections and improves patient outcomes. Consistent adherence to these practices is essential for maintaining a safe healthcare environment and ensuring quality patient care. 8. How do you communicate with difficult patients? I communicate with difficult patients by remaining calm, respectful, and empathetic. I actively listen to their concerns, acknowledge their feelings, and provide clear explanations regarding their care. Maintaining professionalism helps build trust and reduce tension. If necessary, I involve supervisors or other healthcare team members for support. Effective communication often resolves misunderstandings and promotes a positive patient care experience. 9. What would you do if a patient refuses treatment? If a patient refuses treatment, I would first try to understand their concerns and provide accurate information about the benefits and risks involved. I would respect the patient's autonomy while ensuring they make an informed decision. I would document the refusal, inform the physician, and continue offering support. Respecting patient rights while maintaining professional communication is essential in such situations. 10. How do you prioritize multiple patients? I prioritize patients based on the severity of their conditions and immediate healthcare needs. Patients with life-threatening issues receive urgent attention first. I use clinical judgment, assessment findings, and hospital protocols to organize tasks efficiently. Effective time management, delegation when appropriate, and continuous reassessment help ensure that all patients receive timely and safe care without compromising quality. 11. What is patient-centered care? Patient-centered care focuses on respecting patients' preferences, values, and individual needs while involving them in healthcare decisions. It emphasizes dignity, communication, empathy, and personalized treatment plans. Nurses collaborate with patients and families to achieve the best possible outcomes. This approach improves patient satisfaction, enhances trust, and promotes better health results by addressing both physical and emotional healthcare needs. 12. How do you deal with workplace stress? I manage workplace stress through effective time management, prioritization, teamwork, and maintaining a positive attitude. I focus on solutions rather than problems and seek support from colleagues when necessary. Taking short breaks, practicing self-care, and maintaining a healthy work-life balance help me remain productive. Managing stress effectively enables me to provide safe, compassionate, and professional patient care consistently. 13. Why is documentation important in nursing? Documentation provides an accurate record of patient assessments, treatments, medications, and progress. It supports communication among healthcare professionals and ensures continuity of care. Proper documentation also serves as a legal record and helps evaluate treatment effectiveness. Accurate, timely, and detailed charting promotes patient safety, accountability, and compliance with professional and organizational healthcare standards. 14. How would you educate a patient about medication? I would explain the medication's purpose, dosage, timing, potential side effects, and any necessary precautions in simple language. I encourage patients to ask questions and verify their understanding through feedback. Providing written instructions when available helps reinforce learning. Effective patient education improves medication adherence, reduces errors, and empowers patients to participate actively in their healthcare management. 15. What is the role of teamwork in nursing? Teamwork is essential for delivering coordinated, efficient, and safe patient care. Nurses collaborate with physicians, therapists, technicians, and support staff to meet patient needs effectively. Good teamwork improves communication, reduces errors, and enhances patient outcomes. Respect, cooperation, and shared responsibility contribute to a positive healthcare environment and ensure that patients receive comprehensive and timely treatment. 16. How do you maintain patient confidentiality? I maintain patient confidentiality by protecting medical records, discussing patient information only with authorized personnel, and following healthcare privacy regulations. I avoid sharing sensitive information in public areas and secure documentation appropriately. Respecting confidentiality builds patient trust and fulfills ethical and legal responsibilities. Maintaining privacy is a fundamental aspect of professional nursing practice. 17. What would you do if you made a nursing error? If I made a nursing error, I would immediately ensure patient safety, report the incident according to hospital policy, and inform the appropriate healthcare professionals. I would document the event accurately and participate in any investigation. Learning from mistakes and implementing preventative measures helps improve future practice. Transparency and accountability are essential components of professional nursing care. 18. How do you assess a patient? Patient assessment begins with collecting medical history and observing physical and emotional conditions. I evaluate vital signs, symptoms, pain levels, and overall health status. Assessment also includes reviewing laboratory results and identifying potential risks. Accurate assessment enables early detection of problems, guides care planning, and supports timely interventions that improve patient outcomes and safety. 19. What is your approach to patient education? My approach involves assessing the patient's understanding, using simple language, and providing information relevant to their condition and treatment. I encourage questions and verify comprehension through discussion. Educational materials and demonstrations may be used when appropriate. Effective patient education promotes informed decision-making, treatment adherence, and improved health outcomes while increasing patient confidence in managing their health. 20. How would you handle a conflict with a coworker? I would address the issue professionally and respectfully through open communication. Listening to the coworker's perspective helps identify misunderstandings and find solutions. I focus on maintaining teamwork and patient care quality rather than personal differences. If the conflict cannot be resolved directly, I would seek guidance from a supervisor. Professional conflict resolution contributes to a positive workplace environment. 21. What are vital signs and why are they important? Vital signs include temperature, pulse, respiration rate, blood pressure, and sometimes oxygen saturation. They provide important information about a patient's physiological condition and help detect health problems early. Regular monitoring allows healthcare providers to assess treatment effectiveness and identify changes requiring intervention. Accurate measurement and documentation of vital signs are essential nursing responsibilities. 22. How do you care for a bedridden patient? Care for bedridden patients includes maintaining hygiene, preventing pressure ulcers, assisting with mobility exercises, monitoring nutrition, and providing emotional support. Regular repositioning improves circulation and reduces complications. I also monitor skin condition and encourage communication regarding discomfort. Comprehensive care helps maintain comfort, dignity, and overall health, while reducing risks associated with prolonged immobility. 23. Why should we hire you as a staff nurse? You should hire me because I possess strong clinical knowledge, excellent communication skills, and a genuine commitment to patient care. My GNM training has prepared me to handle diverse healthcare situations professionally. I am a quick learner, a team player, and dedicated to maintaining high nursing standards. I am committed to providing compassionate, safe, and effective care to every patient. 24. How do you stay updated with nursing practices? I stay updated by attending training programs, participating in workshops, reading nursing journals, reviewing clinical guidelines, and engaging in continuing education opportunities. Learning from experienced colleagues and healthcare professionals also enhances my knowledge. Keeping current with evidence-based practices enables me to provide high-quality care and adapt to advancements in healthcare and nursing standards. 25. Where do you see yourself in 5 years? In 5 years, I hope to become a highly skilled and experienced nurse recognized for providing excellent patient care. I plan to continue my professional development through advanced certifications and specialized training. I aim to take on greater responsibilities, contribute to healthcare improvement initiatives, and mentor junior nurses. My goal is continuous growth while maintaining a strong commitment to patient welfare. Preparing for GNM Staff Nurse Interview questions helps candidates demonstrate clinical competence, professionalism, and confidence. Employers seek nurses who can deliver safe patient care, communicate effectively, and work collaboratively within healthcare teams.